something that you may not necessarily know, but the GMC is very clear on how you should react to that. Hi everyone, welcome to the channel. My name is Sarah, I'm a junior doctor working near London, and today we will be talking about the SJT. I'll be going through concrete examples, deconstructing the questions from the official papers, and showing you the reasoning as well as the key words that are really important to pick up. And you'll see how you can answer questions quickly and efficiently, and you can do the rest of the official papers by yourself using the same reasoning. Now, we've talked a lot about the importance of timing in this exam, and whilst it is important that you keep timestamps and you make sure you stay on track so that you finish everything, it is very important that you read every question properly. Because even if you end up with half an hour at the end of the exam, but you've rushed through reading the questions, you probably will have made some mistakes and not picked up the nuances in the exam, which means that when you get to the end, yes, you've got enough time, but actually you've probably lost a lot of marks. So like all things in life, it is a fine balance. And that's why I recommend timestamps around every 20 minutes, because that gives you a good idea of whether you need to speed up or slow down. And hopefully by using the technique of most appropriate and least appropriate, it'll give you enough time to read through the question properly and then answer accordingly. To be honest with you, out of all the revision that I did over the month and a half before my SJT exam, the absolute most useful thing I did is to spend 3 sessions over a couple of days with a friend, and we printed out the 2 official papers. We went through each question line by line and deconstructed everything. Now, it sounds like overkill or it sounds like a lot of work, but actually it was the most useful because it helped us really understand the importance of every key word in a question and the rationale behind it. And by doing that, we were able to come up with guidelines that gave us a really good idea of what the GMC looked for in particular situations. And that was incredibly useful. Notice I say guidelines and not rules, because one mistake that I notice a lot of people making is reading through a question and building a set of rules and saying in this situation X will always be most appropriate. That's not always the case. As you notice, if you deconstruct question and options, you'll realize that sometimes they'll change a couple of words and that changes the whole nuance of the question, and all of a sudden that fixed rule that you made doesn't apply to it. So make sure that when you're deconstructing the questions, the primary focus is on understanding the importance of the words and the rationale behind the question. Now, if you remember, we mentioned in the rating questions that you want to answer each option independently of the other. In the MCQs, it's totally the opposite. When you pick your 3 options out of 8, you want to make sure that they make sense together as a combination. And the way that I help myself do this is I'll say option A and option B and option C. If you connect your 3 options with the word and, you'll be able to see if they fit well together. And if 2 of the options have an overlap or you see that they're repeating each other, that's definitely a good sign that you've got one of them at least wrong. As you know, the trickiest thing in the MCQ questions is that most of the options look right, but some of them are more right than others, and in combination you want to pick the ideal bunch. So for example, if one option is saying, tell your consultant that you are concerned about X, Y, and Z, and the second option says, tell your consultant that you're worried about X, Y, and Z, and then document your reflections. You would never pick the first option and the second option together, because if you connect them with the word and, you'll realize that there's an overlap in those 2 options. Both of them include telling the consultant, and you wouldn't do that twice in a real life situation. So that's a really helpful way to think about the MCQs and make sure you use that connective word. And I'll be showing you examples of these in the next video using the official past paper questions. The second really helpful tip is for the ranking questions. Now, the ranking questions, unlike the MCQs, have to be independent. So when you're answering the ranking question, you need to think of it as the most appropriate option is the only option that you pick. And if not, then you would pick option B, and if not, you would pick option C, and so on and so forth. So I use the connecting word and if not, and then pick the second option. That's really helpful because when you're going from the rating questions to the MCQs to the ranking questions, you can start to get confused by the different approach that you need to have, and you get decision fatigue. And whilst in the MCQ you want to think of your 3 options as a combination together, in the ranking question, the connecting word is really helpful because it reminds you that each option is independent and should be done as the only thing that you do. So for example, if there is an option saying that you would tell your consultant, and then another option talks about telling your educational supervisor or your fellow F1, you would pick the only thing that you would do in that situation. So for example, number 1 would be I would tell the consultant, and if not, you would tell the educational supervisor, and if not, you would tell the F1. So that's how you need to think of the ranking questions. And although it might seem obvious, the connecting words are incredibly useful when you're getting decision fatigue and you can't really remember the approach that you need to have for for that particular question type. I just want to talk about some resources that you can use. Now, I'm sure most of you know about the Health Education England website, where you can find the videos talking about the new changes for this year. There are also, of course, the 2 UKFPO sample papers. Now, what I strongly advise is for you to use the rationale of these 2 papers as your only rationale. Do not go to question banks or books looking for rationale, because it will confuse you. The only reasoning that you can trust is the one from the 2 official papers, because that's what they're actually looking for. If you really want to do extra practice and you're finding that you've already done the official papers and you're getting bored with them, you can definitely use question banks. So I personally use PassMed, and there's lots of books out there that can also be helpful for practice. Just make sure that you don't use any rationale from them. The only rationale and reasoning that you want to have is from the answers of the official papers, because that's what the exam is going to be focused on, and that's how they want you to think. So as we mentioned before in the study plan, you want to focus on structure, rationale, timekeeping, and then the layout of the exam, and that's the last step. So for the structure, feel free to use question banks and books to do more practice questions, and that definitely will just get you used to looking at the same type of questions and knowing how to answer them. For the rationale, just the official papers, and then when you get to timekeeping, you can use the official papers and again, all different kinds of resources, just to make sure that you know how to timekeep and you're sticking to the timestamps that we've mentioned before. Finally, for the last bit, which is just getting used to the layout of the actual exam, I would recommend doing the new sample paper on the Pearson VUE website. Now that's going to resemble your SJT exam the most, so I would leave it to the very end and make sure you go and have a look. Do the practice questions. Unfortunately, there's no rationale or mark scheme, so that's not really going to be helpful for reasoning, but it's definitely helpful to see what the layout's going to be like, so that on the exam day you can just go into beast mode and answer all the questions efficiently without being surprised by the arrangement. Last but not least, I would definitely recommend that you go onto the GMC website and look at the Good Medical Practice PDFs. Like I've said, all the questions are divided into one of the 4 domains from the GMC, so it's definitely helpful to look at those 4 domains and understand how questions fit into that and what reasoning you want to have. What I find particularly helpful is their ethical scenarios section on the website. Now that's really good, because whereas the 4 domains can be a bit too theoretical and you may not necessarily see how that can be really helpful in the exam, the ethical scenario section is much more practical. So it'll really hone in on those 4 domains, but in scenarios that will help you think like an F1 and get you that much closer to answering the questions correctly. This is particularly helpful for some questions, for example, if a patient gives you a gift. Now, the guidelines are very clear as to how you would react to that. For example, you should know that you can't accept any monetary gifts from a patient. You can take small gifts like a box of chocolates, especially if you can give it to the rest of your team as well. And if you're unsure, you can always speak to the nurse in charge, who will give you advice on the guidelines. Now, this is something that you may not necessarily know, but the GMC is very clear on how you should react to that. So it's really helpful to go read their PDF and make sure that you're up to date with that information.
So the way this is going to work is I'm going to put the first question up, pause your video, make sure you go through it focusing on the rationale rather than speed at this point. I'm then going to explain the answers and run through the tips that we've mentioned before and how you can actually use them to answer the question efficiently and get the most marks out of it. Let's jump right in. So the first question is a ranking question, and it's about communication. So the first thing that you want to focus on when answering the question is, where does this fit in the GMC domains? And this one is about patient confidentiality. It's helpful because then it helps you rank the most appropriate ones that are prioritizing this topic higher up, and then ranking the least appropriate ones lower down. Now, the least appropriate option is A. Why is it A? Because doing nothing in this situation is the least effective measure, as the error might occur again and you've done nothing to prevent it. The most appropriate is B, because communicating with the F1 who has made the mistake is the best thing to do. Asking him what he knows is a better opener than telling him that he has done something unacceptable. So the reason why number 1 is the most important, and you'll find this again and again, is information gathering before you do anything at all, before you act or judge somebody, is the most useful thing. And remember when I said that I sat down with a friend and made some guidelines, remember these are not rules. So information gathering is not always going to be the first option, but it is a general trend that gathering information asking questions is always a better thing to do. And you'll see this in real life scenarios in the hospital. You always find information out before you act on them. So as you can see now, we've got the most appropriate option and the least appropriate. That makes our job easier because now we've got 3 left. So going through them, so B is better than E because A, you're gathering information first, so maybe there's a good reason or there's an explanation to why this has happened, and you're also checking what the person's understanding is before you actually correct them. And just like taking a medical history from a patient, you first check their understanding and then you give them information. So E is much too strongly worded, and that gives you an idea that it's going to be lower down, okay? Then you get to C. C raises the topic, but it raises it more indirectly. So it's not raising it directly with the F1, but you're mentioning it in the next teaching session. So it's good, but it's not the best because it's an indirect way of dealing with the problem. D, notifying your consultant, is not really going to help directly because your own consultant is not going to be involved with the F1 unless he happens to be the educational supervisor of said F1 who made the mistake. So that tells you that the way that you want to address an issue is time sensitive and person sensitive. So you want to make sure that you deal with the problem as quickly as possible and as directly as possible. So going back to number 1, in that scenario, you're going directly to the F1 immediately, and you're checking their understanding and addressing the issue straight away. When you get to the teaching session, you can see it says at the next teaching session. So that means it's not going to be time sensitive, it's going to be in a little while, and you're not addressing it directly with the F1 alone, it's more of a general thing. So it's good, but it's not as good. So to summarize, the main tips here are going to be most appropriate and least appropriate first. You want to make sure that as a general guideline, you can think of time-sensitive solutions and directly addressing the problem yourself is a better way, so it's going to be more appropriate. And information gathering is usually very high up as well. And you want to make sure that you don't pick options that are too strongly worded. Moving on to the second question, procedures. Again, pick the most appropriate and the least appropriate. So I think it's obvious to say that in this scenario, B, perform the procedure alone, is the absolute worst thing you can do. Going back to the domains, this one is about patient safety. So you performing a procedure alone that you've never done before, it sounds like the most unsafe option you can possibly do. And actually, declining to perform the procedure, so in other words, doing nothing, is less dangerous than you actually doing it alone because you don't have the necessary skills. Somebody may argue, yes, but the patient is sick and they need to be treated. Remember that when you're answering these questions, it's not about what should be done as a general scenario, what the team of medical doctors should be doing or how the hospital should treat this patient. This is about you and your actions, and remember that you need to act as the ideal F1 and only act within your remit. Anything that you do that threatens patient safety is unacceptable. So it's always a good thing to get teaching and supervision from an experienced colleague. This, by definition, is going to make the patient safe because the experienced colleague will be able to safely do and teach a procedure. And once you've observed a few, you're ready to perform the procedure yourself under supervision. So that's why E is number 1. Again, going back to our previous tip, you're addressing the problem directly because you're doing it yourself, but in a safe way, so you're not sacrificing patient safety. The reason why B is wrong, although it's addressing the problem directly, is that it's threatening patient safety, which E doesn't do at all. So that's number 1. We've now got the most and least appropriate, so let's go through the other ones. In terms of A, finding a senior colleague to do it, getting such a person to do the procedure is a reasonable option, but you are partly shirking your responsibilities and missing the opportunity for training. And if there's no one experienced around, then the safest thing for you to do is to politely decline. So A is good because, again, patient safety is fine, but it's not as good as E because you're not addressing the problem yourself directly in an area where you actually have remit to do so in a supervised environment. D is still better. A lot of people will tell you, oh, do nothing is always the last option. That is not true, and that is why they're guidelines and not rules. Sometimes, like in the previous question, doing nothing is the worst thing you could do. Here, it's not the worst thing. This is why it's really helpful to think of what's the main GMC domain that's being addressed here. And here it's clearly patient safety. So anything that sacrifices patient safety is going to be lowered down. So most appropriate and least appropriate first of all. Think of, in terms of guidelines, think of where am I addressing the problem directly, and where is it time sensitive, and finally thinking of the GMC domain, what is the main point and what is the main domain that is being assessed, and how do I make sure that that's not sacrificed in my options. So another question, this is again a ranking question about gifts. This is a pretty straightforward one, and it brings me to one of my points, which is about knowing what the GMC wants. And whilst in the other questions there have been some nuances, the GMC is very clear as to how doctors should react to getting gifts from patients. Now, the GMC does say you must be honest and open in any financial agreements with patients. In particular, you must not encourage patients to give, lend or bequeath money or gifts that will directly or indirectly benefit you. The general consensus on gifts is it's okay to accept small gifts, especially if it's something that you can share with the team and the other healthcare professionals, like chocolates that you can leave in the kitchen or staff room. If you're unsure of accepting any gifts, then you can always speak to the ward manager or the ward sister, who will be able to advise you about that. But it's pretty clear that you would never accept monetary gifts. The reason why C is definitely better than D is because D is reprimanding the patient. The wording in the option is stronger, and that makes it less appropriate. So you always want to think of the way that you would express yourself and speak to a patient, because you don't want to make the doctor-patient relationship suffer. So reprimanding a patient you would avoid if you can. Again, B is going to be lower down in the option list because you're still taking a small cut of money from the gift. So whilst A, you're accepting everything, which is completely unacceptable, B, you're accepting part of it, which is still unacceptable. So that's going to be the before last. Now, between E and D, the reason why E is higher than D, you're still not doing anything wrong. You're discussing with the ward sister before considering acceptance of the gift. So whilst you should be aware of the regulations and pick A, E is still appropriate because you would eventually get to the right answer by seeking information. It just deals with the problem less directly. Let's finish with an MCQ type question. Remember that the main point for these MCQs is think of what the focus in terms of the GMC domains is, and then make sure you fill in the gaps between the three options with and, so that they make sense together and they're not repetitive. So one of the clearly obvious ones is informing your consultant about your error. Your consultant is responsible for your actions as your trainer, and it's essential that he or she knows what has happened. So that's why that's one of the options. F is also very important because the patient who may have been harmed by the fluid should be informed, and it makes sense to apologise to them. G is also one of the options because rewriting the drug chart for both patients is important so that you're directly correcting the drug chart error and ensuring that more of the wrong fluid is not given. Now, this may be misunderstood as crossing over your error on the drug chart and hiding your mistake, but actually rewriting a drug chart essentially means you're writing it up again correctly. Okay, so it's not about hiding your error. It's about making sure that the error is not continued or repeated. Now, some of you may be wondering why D is not a good option, inform the dehydrated patients, since F was an option. The reason why F is an option and not D is because F, you've actually administered fluids in error, so you've actually potentially done direct harm to a patient or come very close to. However, the dehydrated patient, yes, you need to give them hydration, but you haven't directly harmed them. The person that you've directly impacted with a direct action, that would make more sense for you to apologise to them. And as you can see, these three options fit together, and you can say inform your consultant and apologise to the patient and rewrite the drug charts. And in that scenario, you would have addressed the problem directly so that you're avoiding any further wrong administration of fluids. you've apologised to the patient, and you've told the person responsible for you. So those are just a few examples of questions. As you can see, the tips we've discussed are very applicable and are really helpful to structure your thinking in a question. Try and keep using these while you're doing practice questions. Focus on the rationale, and once you've got that down, you can go back to your game plan and start working on your timing.
So there you have it. Those are all my tips in order to ace the SJT. If you follow these simple steps, there's absolutely no reason why you shouldn't do extremely well in this exam and raise your whole FPass score. Now remember, this is just one exam. It will pass like everything else, but you can do really well in it if you prepare properly and in a smart, efficient way. If you enjoyed this video, please like and subscribe and share with anyone who might benefit from it. Comment down below if there's anything you'd like to see in the future, as well as if you have any SJT questions that you'd like answered. I'll see you in the next video.